once the button is clicked.
Good afternoon. Welcome to this month's Research Matters. For this session, the HRPP has teamed up with the Office of Clinical Research to combine Research Matters and Research Connections. I am Erica Salzik, and I'm the Department Administrator for UT Southwestern's Human Research Protection Program. Before we jump into today's presentations, here are some general housekeeping items. First, if you have any questions for our presenters, please type them in the Q&A. One of our moderators will respond to you during the session, or we will address it at the end of the presentation. Second, this Research Matters session is being recorded and will be available immediately after the conclusion of the live session. You may access the recording by clicking on the same link provided in the Outlook appointment. And shortly after the conclusion of this session, we will send out any slides and/or handouts via the listserv. You will also be able to access the recordings and documents on HRPP's Research Matters website, which can be found under the Training and Resources page. Finally, we provide a certificate of attendance to those who have logged in using a valid email address. This email will from the listserv email and will only be sent to those who have logged in with that valid email address. As always, if you have any questions, please send an email to hrpp@utsouthwestern.edu. On the agenda today, we will begin with HRPP office updates, followed by a presentation on how to do annual updates in clinicaltrials.gov, and then we will jump into our featured presentation on RL Solutions. So Josh, take it away. Sorry, Josh, will you unmute yourself?
Wow, you think that a year into this we'd be all really good at it, but definitely not. Okay, so very quickly, we wanted to welcome Amanda Smith to the regulatory analysis team. She'll be working with Chuck Akers and the rest of the analyst team doing pre-reviews. We have 3 open positions that are available on the external websites, a senior regulatory analyst and a regulatory analyst on the regulatory analysis team, and a regulatory analyst on the investigator relations team. We also have a couple of announcements. So the first announcement is that we have an update related to our translation vendor. So we're in the process of switching vendors for translation services, but I want to make it absolutely clear for study teams that there will be no process changes for you. In order to initiate a request, you'll still be submitting the Form Z, Z like zebra, to our office. You can either send it directly to myself or more preferably to the HRPP mailbox to initiate that translation project. The new vendor is United Language Group. They have a great reputation and a lot of experience with human research and other academic medical centers. As we were going through the process, we chose them because of their great reputation, but also because they were offering a lower price for most of our common languages, especially Spanish. And that includes no minimum fees. So if any of you have ever processed a modification for an approved document, that minimum fee from our prior vendor was always going to be about $210, and that will no longer apply. There will also be no formatting fees. So we expect that we should see a drop in prices across the board for our translation projects. And it's also important to note that all previously translated content from our prior vendor will be honored in all future projects. This means that any translated documents that have already been processed through our prior vendor will be accepted as is and will be able to use for future translations. And in addition, all of the memory that we've built up over the past 3 years of working with this vendor will also be pulled over. So we'll continue to see price reductions as we build that memory out even further. The other update was that the HRPP IRB is updating our fee structure. And so this is a big overview of what our current fee structure looks like. This is the column right here, fees expiring October 14th, 2021, and our new fee structure. And you'll notice that there's really two major changes. Those are the changes that are highlighted. Essentially, the HRPP/IRB fees will be adding a modification fee, and that will be effective on October 15th, 2021. Couple of notes about the fee structure changes. So there's no substantial changes to the studies that are fee eligible. There is a slight change in that we have added on multi-center studies where UT Southwestern is serving as the single IRB of record. That was always there, but we've made it a little bit more clear. The modification fees will only be assessed if that modification is initiated by a study sponsor. So if we have a modification where the local study team notices some mistakes in a consent form and those need to be modified, that modification fee will not be assessed. And it's also important to note that the new fees will be effective for any study where the contract is submitted in e-agreements on or after October 15th, 2021. So this will not be based on when the study is submitted to the IRB for review, but when the contract is submitted. So that way you can work with the study sponsors, make it clear what the fee structure looks like as you're moving into new discussions. Any discussions where you've already relayed what the IRB fee structure looks like, you have until October 14th to get that agreement in through e-agreements for institutional review. We wanted to also let you know about the plan in relating to rolling this change out to the community. So we have a communication plan that is being followed to ensure that all receive this message. So after this Research Matters Research Connection session, an announcement will be sent to the listserv with an announcement. And then just jumping down to the last bullet point, a contract template that we've developed so that departments can provide this to study sponsors about what the IRB fee structure looks like. In addition, we'll be talking with department administrators. We'll be doing some road shows with local departments. So we are going to try and touch as many people as possible to make sure everybody gets this message. The revised fee structure has already been uploaded to the HRPP website. That was done as of about an hour ago. So if you go to the new website, you'll be able to see the current fee structure up until October 14th, 2021, and the new fee structure. And this is available on the news page, on the IRB page, and on the SIRB pages. And with that, we'll go ahead and move into our presentation from Razija Nambiar. Just give us a second as we transition presentations. Thank you so much, Razija. Take it away.
Yeah, thank you so much, Josh. So good afternoon, everybody. I'm Razija Nambiar, and I work with Eriko Iwatate in the Regulatory Support Office in HRPP. In the last Research Matters, Eriko just finished her little series on ct.gov general information. She ended how to do registration and results reporting, and I'll continue with the how-to series. So today I'm going to go over how to do annual updates. First, starting with what is an annual update. It is similar to a continuing review in ERB. And if you are the sponsor investigator for your IND IDE, it is similar to the annual reports sent to the FDA. Next is why do we have to do it? Well, it is required by the federal regulations. Just so you know, not doing annual updates is also considered non-compliance. As you can see in this image here, investigators started receiving notice of non-compliance letter from the FDA. In fact, the STAT article also recently featured about this. So once you receive the notice, your name and your record will be made public as an offender. So it is very similar to the warning letter from the FDA. Just be aware that not doing the annual updates will result in civil money penalties. These are pretty drastic fines and is a good reason why we want to stay in compliance. Please note that the institution will not back you up on this. PI will be personally responsible for these fines at UT Southwestern. So when is it due? Annual updates are due at least once every 12 months per regulation. Next, coming to which kind of records require annual updates. It is required for all active records, regardless of the funding source, that is applicable clinical trials, NIH-funded clinical trials, and for trials for which registration information was voluntarily submitted. Then finally, you would want to know how to do the annual updates. I've created a step-by-step guide that will soon be available on our website. Now, let's review these steps in the next few slides. This is a high-level overview, and I'll quickly go through each step, explaining how to navigate through the system. The first step is to log into your PRS account with your username and password, as you see in the snapshot here. If you don't have an account or encounter any issues logging in since you have forgotten your username or password, then please email us and we will help you get it set up. Then the next step is to click on the open link on the left-hand side of your ct.gov page in order to open your record. Once you are on the record summary page, click on the open link on the left-hand side to go within the protocol section to do the annual updates. Next, you need to review the entire record to verify the accuracy of the clinical trial information and make necessary changes. Then you need to click Edit to open the study status section that needs to be updated. Once within the Edit Study Status page, as shown in this top image here, update the record verification date field with the current month and year and click Save. The reason I have highlighted this box in a separate color in this flow of steps is because this step is often forgotten, and this is the most important step. Doing annual updates is also the time to revisit to see where you are with your primary completion date. If it is soon coming up, or if you have already reached the primary completion date, and if the results are due. Thus, this annual check is very important and helps you keep your record on track. So once you click Save, as you see in this bottom image here, you land on the protocol section page where you can click on the record summary link on the left-hand side corner that takes you to the main record summary page as shown on the next slide. Then click this Entry Complete button that you will find on the main record summary page. The final step after this is to request the responsible party, that is a PI, to review the complete record, as a responsible party must verify the accuracy of the clinical trial information being submitted, and then click the green Approve and Release buttons to submit the record for ct.gov review. So again, to summarize, these steps will help you easily do your annual updates. If you still have any questions, please feel free to reach out to us. In the next few slides, I'll be winding up my presentation. As you see here, with everyone's efforts, we were able to achieve 100% compliance since January, as per the FEDA Non-Compliance Trial Tracker website. And in August too, we were able to maintain this 100% compliance. Again, important to note that this 100% compliance is for FDA-regulated applicable clinical trial results only, and does not include NIH-funded trials that are not applicable clinical trials, or trials that are voluntarily registered. This shows overall real-time compliance for all UT Southwestern records. Our goal is to keep the problem records as low as we can. The fed-up problem records are indicated here as red. The non-fed-up problem records are indicated as orange, while the green ones are the records with no problems, and the blue indicates the total number of records. Here is a list of resources for your reference. We also provide training in person if you need any help doing these updates. This is my last slide. Here is a selected list of resources that would be helpful for you. At next Research Matters, my session will be about how to do the record updates. Thank you everyone for your time listening to me, and I'll take some questions if you have, or you can always email us and we'll get back to you as soon as possible. Thank you. Over to you, Josh.
Thank you, Razija, and we'll transition to the other slides. So we did have one question that I see Rhonda just addressed. We do have a question I see Kimberly's responding to it, but I'll just notate again that a copy of the slides will be sent out with the listserv announcement after this. We have our next set of slides up, and so I'll go ahead and get us started. So this is going to be working through event reporting and research clinics. So it's going to be talking through the patient safety event reporting versus EIRB reporting. I want to be clear that this presentation is specific to the requirements here at UT Southwestern. So this does not address any reporting requirements that you might have with external entities, whether that's your study sponsor or other institutions, especially if we are not serving as the IRB of record. But we'll be talking through the reporting requirements based on what is required on the IRB side and the patient safety event reporting side. On the IRB side, that's all going to be managed by the HRPP. On the patient safety side, that's going to be managed by our patient safety office. So as you all may be aware, the HRPP is responsible for ensuring that all human subjects research conducted by faculty, staff, or students at UT Southwestern is conducted ethically, conducted in compliance with our federal regulations and our local policies. As part of the HRPP, the Institutional Review Board Office is responsible for reviewing all the submissions that you can send in to us related to research studies, and that includes the reportable events. So I wanted to review a couple of common terms that we're going to talk through as we move through this presentation. The first one, non-compliance. Non-compliance, I think, has a really bad name, but non-compliance just means that you didn't follow the federal regulations, the state or local laws, institutional policies, or the requirements of the IRB. And this includes following the approved protocol. So if a patient shows up out of window, that is non-compliance. That doesn't necessarily mean that it's bad or anybody's fault. And I want to clear that up, that non-compliance does not mean bad or anybody's fault. It's just non-compliance. Moving on to serious non-compliance, that is any non-compliance that increases the risks of harm to subjects or adversely affects the subject's rights, safety, or welfare, or adversely affects the integrity of the data and research. And with continuing non-compliance, this is non-compliance where there's a pattern of repeated activities where the study team is non-compliant after initial discovery. So this requires reporting within EIRB and some form of determination from the IRB about that non-compliance. Another common term is a UPERSO. UPERSO stands for unanticipated problems involving risk to subjects or others. So this is any instant experience outcome that meets all three of the following criteria. It has to be unexpected in nature, frequency, or severity. So that means that if a drug says has a common side effect of a migraine in 1% of people, but you're seeing it in 10% of people, that's now unexpected in the frequency or severity of those migraines. In addition, it has to be probably or definitely related to the participation in the research, and it has to suggest that the research placed subjects or others at a greater risk of harm than was previously known. UPERSOs will include unanticipated adverse device effects, or any deaths or serious injuries related to humanitarian use devices. I want to point out very quickly that any adverse events or serious adverse events, other common terms that many study teams know very well, can be UPERSOs. But not all adverse events or serious adverse events are necessarily EUPERSOs, because they may be expected or they may not actually be related to the participation in the research. So it's very clear to note that the IRB requires reporting of EUPERSOs, not adverse events. And a good tip when it relates to EUPERSO is that if there's no change required to any of the study documents, whether it's the protocol, where you don't need any corrective action plan, then it's probably not a EUPERSO. So in terms of what must be reported, you must report any serious or continuing noncompliance. And as you potentially have noncompliance and you're not sure if it rises to the level of serious or continuing, you can submit that inside EIRB, or you can also reach out to us and say, I've looked at the definition, I think that it may or it may not, can you confirm this for me? You also need to report EUPERSOs and the UADEs. In terms of when you must report those, any serious or continuing noncompliance or EUPERSOs within 5 working days, and they have to be reported within EIRB as a reportable event. So here's some quick screenshots for those of you who haven't needed to submit, or maybe it's new to you. When you're looking at a study inside the system, on the left-hand side, you have a bunch of actions, and the final things that you're going to see in that left-hand menu are these 3 buttons if you don't have any open studies, and it also requires that your study is approved. You'll see the 3 buttons. The first one is New Reportable Event. So after you log into EIRB, you find the study where you need to submit the reportable events, you're going to click on that button. After you do that, the first thing that you're going to see is a new page where it's going to ask you what type of reportable event do you need to report. And so you can see we have a couple of things that we haven't discussed, single subject exceptions and short form requests, and we can talk about those in a separate conversation, but there's non-compliance and EUPERSOs as the 3rd and 4th option. If you're unsure about what maybe you need to select, we do have some wonderful guidance on our website, and I'll link to those in just a second. After you select the appropriate option here, you're going to fill out the rest of that form. It's going to require you to put information related to what happened, when did it happen, who have you already notified, do you have any corrective action plans, do you have any supporting documents related to this reportable event. And if you ever have any questions about how to fill it out, you can always reach out to us as well. So as I mentioned, here's some really helpful resources. Our 3 policies related to EUPERSOs, non-compliance, and reportable events. The reportable events guidance has some amazing information related to really dissecting what happened and figuring out, does it fit into any of the prompt reporting requirements? And it also addresses the single subject exceptions that we didn't address already.
All right, let me make sure I'm off of mute here. So I'm honored to be here with Josh today, talking a little bit about event reporting. So my name is Angie Verghese. I'm part of the Health System Patient Safety Department, and I'm actually the manager for the ambulatory safety arm within that department. So my involvement with this project started a couple of years ago. So some of you may have been involved at that time and actually had the honor of being able to visit some of your research clinics at that time with some of the ambulatory operations folks. But there was a concern that a lot of the ambulatory clinics were kind of being left out or not having the same resources as a lot of our other UT Southwestern ambulatory clinics. And one of those areas is specifically related to event reporting. So it's one of the reasons why we wanted to partner with HRPP to make sure that everyone is familiar with event reporting. So like Josh mentioned, you know, there's lots of reporting that you all are responsible for. He covered the HRPP and the IRB reporting. So what I wanted to cover is the UT Southwestern expectations and kind of our processes that are set up to do event reporting. So adverse events, errors, things like that relate to a UT Southwestern system or process. So this first slide is really just a little bit about our department. We fall within the Health System Quality Department. So some of you may be familiar with Dr. Will Daniel. He's our Chief Quality Officer. We fall within his team, overall team. And so just kind of our philosophy, you know, we work with the clinics, the ambulatory clinics, the hospitals, and then now with our research clinics as well, to look at adverse events and errors, any kind of deviations that happen in any of these sites. So we believe that we should not punish humans for making errors. We know that humans do make errors and we're all human. So, but we believe that we can design systems and processes to try to reduce or eliminate that type of human error. It's important that we report these errors because we need to learn from them. So we really encourage a culture of safety where everyone feels free to speak up when they see an error, when they're involved in one, or maybe even if there was a near miss that was caught before it reached the patient or the individual involved. We want to be transparent and we want to learn again, you know, from these types of events. So. All right. So when we talk about event reporting through our department, we use a system called RL Event Reporting. So RL Solutions is what I think is most commonly known as. That's a little bit of an older term, so that we actually call it RL Event Reporting now. The software we use, the company has actually renamed it, so they no longer use RL Solutions. So what do we report through the system? So, like I said, we're looking for patient safety related incidents or risks. So this could be an error or it could be a near miss, meaning we caught it, any kind of deviation or unusual kind of incident when it comes to UT Southwestern processes. So, and the key is that it caused harm or had the potential to cause harm to a patient. So there are some examples listed here that come from our website. We pretty much encourage our clinics and hospital staff, though, to, you know, if you have doubt, go ahead and report it. So we don't have the strict reporting rules as some of the other IRB and, you know, other research regulatory type reporting definitions and things. So in general, we do say, when in doubt, report it. We'll look at it and see if there needs to be any further review. So, and why, again, I kind of touched on this. We really want to learn from these events. There's a lot of improvements we can make in our processes, but we can't do that. We can't look at those processes unless we report, unless we hear about it. So, to keep those statistics as well. So just like Josh showed, I wanted to show a little bit about how you report, and it can get very confusing, I know, with all the different systems that we use here. So this slide, when you get it, will have a link to the RL event reporting system. That link is available on our website. It's available through Epic if you use that. It's available through the clinical portal, a couple of different places. So hopefully when you're in it for the first time, if you'll bookmark it, it'll be easily available for you. When you first log in, you do have to use your UT Southwestern user ID and password. There's an option to report anonymously, but again, we're going for a culture of safety where everyone feels comfortable speaking up. So we also have various other resources on our department website as well. And reach out to Josh or to me directly and we can direct you to that website, or there's a link here. But, you know, in terms of how do you report, what kinds of events need to be reported, that kind of thing, there's lots of resources there. You log in, this is what you'll see. We call this our icon wall. So these all represent different electronic forms that you can use to report various types of events. So we encourage everyone, you know, if you're not sure, choose what seems to fit the incident that you're trying to report. If it was a patient fall, certainly that's an obvious one. If it was medication related, if it was related to care coordination within UT Southwestern, you know, hospitals and clinics, certainly report that. Lab events, you know, lots of different options there. Be factual. So this is not where you express your frustrations with lab or with another clinic or, you know, or another department. Really, again, the intention is to report so that we can look at processes and systems and look for process improvement opportunities. So use your best judgment. All of the electronic forms do have required fields, so use your best judgment. That should not be a deterrent for reporting. On the back end, when we receive those electronic forms, we can make corrections and adjustments to a lot of those fields if we feel like it's necessary. So we did add a specific field to the electronic form, and it asks, is this related to a clinical research study? So keep in mind, we use this system for all of our clinics and all of our hospital patient visits and encounters as well. So that's going to be the vast majority of what we have in there. But we wanted to make sure that we have a way to capture if a particular event is related to a clinical research study. So that would be a yes or no answer there. Same way, if you have an ambulatory clinic that reports an event related to a patient, they also have the ability to say this was related to a clinical research study. And what happens is the yes answer on that question actually prompts an alert to Allison Beaver. I'm sure most of you know her with the Research Administration Office. So she is kind of our primary reviewer for these research-related events that get reported into our system. So she will review those to see if, in fact, it was related. She will be a liaison between, the IRB and HRPP folks, and also our department, to kind of see what needs to be done, what further reviews are required. So kind of what happens next after you report one of these is, so like I say here, Allison and maybe also John, but primarily Allison, they receive alerts so they can do their follow-up. Our department, we have coordinators who review these, and we'll review those and may reach out to Allison if we have specific questions. And Allison will really be the primary kind of go-between between the PI or the research study coordinator and in terms of answering questions about the incident, whatever happened. Once everything's been answered, we feel like we've made any corrective actions that are reasonable, then we will close the event, and you'll definitely be able to track the progress of the event that you reported within the system as well. So event reports, again, they're very vital for looking at safety risk and really keeping statistics around that, which is very important to our quality efforts on campus. We want to identify opportunities for process improvement. And really, we want people who have firsthand knowledge of these incidents to report those. Supervisors can report them, but sometimes if they weren't there, they didn't see what happened, they don't know a lot of times all the details that are important to know. Event reports, though, are not meant to be used for immediate escalation. So we tell our clinics, for example, if you have a pipe that's leaking, don't just put in an event. Call somebody, get in facilities or building management, get that taken care of. If you have a patient who fell and is hurt, call 911, or we have rapid response teams. Use those kind of immediate resources to take care of the immediate need, and then report those afterwards, after the initial response. We should not be using these for employee disciplinary action too. This is something we feel very strongly about. We want to encourage reporting. That means that we don't write people up if they report that they made a mistake or they were part of a near miss or something like that. And they're definitely not a waste of time, and we're really trying to promote reporting. So there's a couple of resources here. There are some policies that relate to that. So some of you may not be aware, but if you work in an ambulatory research clinic, the scope of the ambulatory policies actually does include you, and that was part of that project that started 2 years ago with Dr. Rollins and her team. So I encourage you to look at some of those policies. So then we have a table to kind of talk about. I'm going to let Josh talk about this. That talks a little bit about the, kind of some scenarios and examples of when you would report to one of our groups versus the other.
Thank you, Andrew. So, and we do have a couple of questions, and I just want to let those people know that we will be addressing the questions at the end of the presentation, but they're really great questions. So the first event type where we have a local minor adverse event, patient fall or other minor injury. So according to what Andrew just provided, that would be reportable to UT Southwestern's patient safety, but it would not be reportable to the HRPP via EIRB, because most likely, unless that patient fall or other minor injury was related to the research, if it was just patient was walking and tripped over a mop or something like that, that would not be reportable to the IRB. For a local serious adverse event, patient death or permanent harm, again, that will be reportable as soon as possible, especially if the event involved a UT Southwestern process deviation to patient safety. With the IRB, it'll be reportable to us if that event met the criteria of a UPERSO. So was that patient death or permanent harm related to the research? Was it unexpected? And we can already sort of check off that it suggests a greater risk of harm to the participant. If we have a local UPERSO, again, most likely this is going to be required reporting through patient safety, as long as that involved a UT Southwestern process deviation, and it should be reported to the IRB within 5 business days of the PI awareness. And you can see sort of now where we're really seeing some overlap. With an external UPERSO, so this is going to be an external unanticipated problem, that would not need to be reported at UT Southwestern through patient safety, but it does need to be reported to the IRB within 5 business days of PI awareness. If we have a protocol deviation, so I'm using that terminology, again, this could be non-compliance, most likely that is not serious or continuing, but I wanted to address that very commonly research teams talk in the vernacular of protocol deviation. That would not need to be reported to patient safety if that protocol deviation was only related to the research protocol. But I think then if this was somehow related to some sort of UT Southwestern process, a lab or a pharmacy drug dispensing process, that would need to be reported. If it was with the IRB, it needs to be tracked and summarized at continuing review. So when you submit your continuing review, whether it's continuing review or annual update, you'll give us the information of what's happened in the last year, and you'll provide that a summary to us. We do not want a laundry list of every deviation that has happened in the last year. We want a summary. With protocol violations, so those generally tend to fall into the non-compliance that could be serious and or continuing. So if we're talking specifically about serious non-compliance or continuing non-compliance, again, this would need to be reported if it involved a UT Southwestern process that was outside of that research protocol. Because this is now non-compliance that is serious or continuing, it would need to be reported to the IRB within 5 business days. And the last thing is potentially making a protocol change without prior approval to eliminate some sort of apparent immediate hazard. That would not need to be reported to patient safety, but it does need to be reported to the IRB within 5 business days of occurrence. So now we're going to go through some sample scenarios, and then we'll sort of go through, is that reportable in EIRB? Is it reportable in RL event reporting? So the first example, we have a research participant whose labs indicate that the study drug should be reduced in dosage. The treatment plan was not modified, but it was caught by the pharmacy when they reviewed labs and prepared the drug. The correction was made to the order and the correct dose was given to the patient. So is that reportable in EIRB? No, because it does not represent a UPERSO. It is related to the participation in the research. It is definitely unexpected that something like this would potentially be missed, but this did not actually result in any sort of greater harm to the participant, and so would not meet the reporting requirements. It should be tracked potentially as a deviation and submitted at time of continuing review.
So then thinking about the same scenario, would that be reported in RL event reporting for patient safety purposes? And the answer is yes, because it does involve UT Southwestern systems, processes. There would be value in looking at, the pharmacy workflows and, the treatment plans and things like that to ensure there's not any opportunities for improvement. So the key there is the UT Southwestern process involvement.
Second scenario, a research subject has passed away. Upon further review, the death is probably related to a reaction to the study drug, which was not previously seen or documented by the study sponsor. So is this reportable in EIRB? Yes, it would be reportable because it says it meets the criteria. I'm going to say most likely meets the criteria. As you all have probably heard us say, it depends a lot of times on really the details. But in this scenario, it's probably better to at least reach out to us and talk with us. Sounds like it was unexpected because it hasn't been documented previously. It probably or definitely is related to the participation in the research study, and it definitely is a greater risk of harm than was previously known.
So then would this be reportable in RL event reporting for patient safety purposes? And we say yes. So unfortunately, sometimes there will be scenarios where you will have to report to both groups. This is a good example, for our hospitals and our clinics. If we have a patient death it's always considered a potential sentinel event. So it's a Joint Commission term that refers to either serious harm or permanent harm, or maybe even death in a patient. So those are always really important opportunities to look at all of our processes surrounding that death to make sure that there wasn't any deviations on UT Southwestern's part in that occurrence. So it was a serious patient harm event resulted from services received at UT Southwestern. Our leadership, our department, we of course would be very interested in looking at that.
And the third example is that we have a research patient who is due to have PKs, pharmacokinetic blood draws, done every 4 hours after the first dose was done on day 1. The first 3 PKs were drawn on time, the 4th and 5th were not collected at all, and the 6th blood draw was drawn on time. So is this reportable in EIRB? So this is where, again, it comes into it depends. So this is definitely non-compliance because you're not following the study protocol. But the question is whether or not the missed draws represent serious non-compliance. So does the information that was missed at the 4th and 5th blood draw represent information that would be vital to ensuring that the subject is not harmed by the drug or whatever the study intervention was, that it doesn't adversely affect the right, safety, or welfare. And also, the last little sentence here really addresses adversely affects the integrity of the study data. I think that's the one that doesn't happen too often, but is really important to consider in this particular scenario. If we've put a research participant in potential harm's way by having them do something that is a research procedure, and by failing to collect the pertinent information, we're unable to answer the research question, that represents serious non-compliance.
And then would that be reportable in RL event reporting? Unfortunately, this is a maybe as well. So again, you leaders in the research clinic will need to use a little bit of judgment. Again, was this event, that lab not being drawn, was it related to a UT Southwestern system or process? So was it, failure on behalf of the lab? Was it related to an Epic issue? Things like that. So if it was strictly related to just your research protocol, again, that's not really our concern. Our concern are UT Southwestern systems and processes. So that would really be the key there. So again, use a little bit of judgment on scenarios like that.
So in conclusion, UT Southwestern institutional policies and procedures require that clinical research areas report adverse events that impact research participants. So this could be done either through patient safety event reporting, EIRB, or both. And if you ever have any questions, feel free to reach out to either patient safety, the IRB, or really potentially other people who've interacted with this. We definitely have a lot of study team members who are going to work through this, so feel free to talk with some of your colleagues as well.
Yeah, and I would just add, kind of just reiterate what I've said throughout, is that, with patient safety event reporting for UT Southwestern, again, our focus is really UT Southwestern systems and processes. So that should be the kind of what you ask yourself when an event occurs, who needs to know about this? IRB, UT Southwestern leadership, and how you report to UT Southwestern is through the event reporting system. So Allison Beaver also, like I mentioned her a couple of times, she's been instrumental in helping us with this, in helping to provide some of these resources to their research clinics. So she's a very good resource for you guys as well. And she, of course, is a liaison for us. So. All right. Do we want to do questions or? Yeah,
so I'll read them off to you, Andrew. So the first question that we have was related to the slide where you had the icon page. And you don't have to go back to it, you can, but they just asked the question of where is the link to this page to getting into, I think, the event reporting system.
Okay. The link is here, the RL event reporting system. If you have trouble, I'm assuming this link will still work when you get these slides. If you have trouble at all, please ask Josh, ask me, ask Allison. We'll certainly tell you how to get there. If you guys are familiar with the health system portal, which is kind of our internal UT Southwestern platform for department websites, we do have a patient safety website. We're located within Quality, so you'll be able to find us that way. We have a whole page dedicated to event reporting, so you'll find links there as well. I don't know if the research clinics really use Clinical Portal or Epic Home Screen, but the links are available there as well. So please reach out if you can't find the link. It's available multiple places.
Perfect. And I think you answered this, but I'll ask the question just to be absolutely clear for the audience. Do we file an event report at UT and Children's if we are seeing patients at Children's?
So what's interesting about that, so the answer is no. So, well, it depends. Okay, so if we're talking about a process or system that's strictly related to Children's, then UT Southwestern doesn't need to know about that. That might be something, in fact, that you have to report to Children's because they may want to know. And what's interesting is, going back to this summary table here, we actually took this and modified it slightly from Children's and their similar, material they have to educate their research area clinics about reporting to IRB versus reporting, kind of internally, with institutional reporting methods. So they have a similar system, just like our event reporting. They use RL, that same software as well. So again, the focus is our institution, our systems and processes. So Children's would, of course, would be interested in things that happen at their facilities.
Perfect. Thank you, Anju. That's good to know, and maybe a good take-home message for the entire community is that if you have something happen and you're not at UT Southwestern, reach out to maybe a contact at that institution, whether it's Children's, Parkland, Texas Health Resources, or Scottish Rite for Children, and find out if that's something that they need reported, just like UT is talking about right now. I know we have all of our contacts here. If you ever have any questions, please reach out to any of us. I do want to go back and address one question. We had a question related to the fee schedule for our new translation vendor. And so, and I just published that. You should all be able to see it. I just wanted to note for the audience that we will be checking with our vendor to see if that is something that we can publish. And if it is something we can publish, then we will certainly make that available. And if not, we would encourage you to, even if your sponsor or other external entity indicates they have a translation service, it will not hurt if you send in a request for a quote so you can compare costs for whoever they may be working with versus United Language Group working with us. And I'm seeing just one question that came in, that the link to sign up for the listserv on our website is not working. Thank you for bringing that to our attention. We will certainly take a look at that. I know earlier this week, we were all having problems getting into the listserv website ourselves. So we will continue looking into what's going on with the listservs, and as soon as we can update that link on the website, we will get it updated, and we'll let all of you know as well. I'm not seeing any more questions pop in. Of course, if you have any questions after this, feel free to follow up with us. Erica, any final comments?
Yeah, thank you again for everyone for attending, and thank you to our presenters, Anju and Rasija and Josh. The next Research Matters session will be held on October 19th, and we hope you guys have a great rest of your week.